have hope.
Does everyone agree?
Absolutely, 100%. There's nothing deterministic about a human body or brain. It remains plastic well into adulthood and aging.
Not even genes are deterministic.
Not even genes are deterministic, and especially not when it comes to mental health, right? One of the cool findings to highlight here is people have done lots of genetically identical twin studies to look at things like heritability of things like depression and schizophrenia. There is still no more than roughly 50% heritability in any of these, which means that what happens to you in life and the combination of your actions and the actions of the world probably play a much, much bigger role than genetics.
The hope comes from the fact that we have managed to develop tools to affect all three of those. So nature, we have been able to nearly double the human lifespan in the course of this last century with learning how to make childbirth safe and how to navigate the different phases of life course. Second, on nurture, we are experiencing much less poverty, much less violent exposure, and more areas of freedom and individual opportunity. The third is around behavior. When we tried to address tobacco, the first 2 decades were spent on smoking cessation. Why don't you have the willpower to quit smoking? Well, because it's as addictive as heroin. That's why we can't get you to stop smoking. And we addressed it through recognizing this is a community change we have to make. You wouldn't have thought we could get cigarettes out of Boston bars and French cafes, but we did.
I might change your bins a little to be more in line with that beautiful description that you just gave. So what I would say is that you have to stop thinking about genes like they're blueprints for anything, because they're really not. When a baby's born, the brain's not finished. Brain has to wire itself to that baby's body, has to wire itself to the world that baby lives in. And so you can't really separate that from behavior. There is this idea that like when you're 20, by the time you're 25, your prefrontal cortex will be done, like a little bell will ring. My daughter says, I'm about to turn 25. I'm waiting to hear that bell to tell me.
Even your daughter's got it slightly wrong.
She's just saying it to torture me. But the third piece is actually context. There's a reason why it's so important to get cigarettes out of bars and out of restaurants, because there's the context is partly what is driving your behavior. There's been this really large debate for like more than 100 years about how much are you in control of your own behavior, free will, and how much is the context in control of your behavior. And the answer is that's just the wrong way to think about it.
What is the right way to think about it?
The right way to think about it is that your brain is being nudged by a gazillion little factors, many of which are inside your own body and many of which are in the world. And just in general, if the context is changed, it will be easier for you to control your behavior. And if the context makes it harder, it will be almost impossible for you.
So if you're talking about well-being, it sort of feels like step one is to define it at some level. Like, what is normal? What should a reasonable person expect in terms of the duration, frequency, and intensity of what people typically think of as negative emotions?
When it comes to emotion, variation is the norm for everybody. If you're feeling negative emotion frequently enough that it's starting to interfere with your ability to sleep, with your ability to eat, with your ability to concentrate, that is when things become a problem.
Having a diagnosis helps you understand when things are becoming dysfunctional and of a medical concern. But in day-to-day life, there's gradations, beyond that as well. And some of the ways that we talk about it in the public health world is, are they experiencing distress?
Part of the reason why people are suffering so much is because the context sucks.
Has the context gotten a lot worse in the last 30 years? Because the numbers are getting worse.
Yes. Well, I want to say yes too, but I'm also cognizant of this. There's this research in social psychology which says people always experience the present moment as being worse
ever
than the past. You have at least in the US, you have school shootings that can happen at any moment. You have economic uncertainty. You have the existential uncertainty of climate change. You have, political uncertainty. And then we had COVID. There are three really expensive things that your brain can do. It can move your body, it can learn something new, or it can deal with persistent uncertainty. But what a stress response simply is, really, is your brain is believing that it's preparing the body for a big metabolic outlay. I think there's pretty good evidence now that many of the mental health problems that people are suffering actually has a metabolic basis. And there's a way to understand why adverse experiences in childhood would lead people to be more vulnerable to illnesses in adolescence and adulthood, because part of what your brain is doing is it's wiring itself to the world that you live in, and it's attempting all the time to anticipate the needs of the body and meet those needs before they arise. That's what stress is. When your brain is wired to a body in a world that is full of uncertainty and maybe threat, it causes a longer term kind of metabolic drag, which leaves you really vulnerable to mood-related disorders as well as physical disorders. The same biological factors that contribute to physical illnesses also contribute to difficulties with mental health. Mood-related symptoms and other kinds of psychological symptoms like inability to concentrate and so on, you see these in physical disorders as often as you see them in so-called mental disorders. So I think that metabolism is clearly important in a range of difficulties that people are suffering from. It's not just the physical ones.
Your stress response and how it gets developmentally sculpted during early periods of life then affects the rest of your health, right? And it affects every organ system in your body. So down to your blood pressure and diabetes and everything else. What I would argue is that the life expectancy starting to dip the opposite way is an indication of the mental health crisis that we have.
How is our country doing on mental health? Like, where do we rate?
What I can tell you is, in general, on health, we do poorly. Our health system leaves a lot of people behind for both mental and physical health. To get to Lisa's point, it's hard to separate these things. A major driver of mental health is lack of employment, lack of food, but also lack of health care. The top 1% of incomes in the United States get to live 87 years on average or more. But the thing that I pay attention to globally is that we have a bunch of countries in the world that outperform their incomes. So usually your survival, your life expectancy in the world is very tightly tied to how rich your country is. And every increase in income per capita translates into years of life. But there are countries that outperform their incomes and countries that underperform. The United States underperforms their income at our income. We should be closer to mid 80s of average life expectancy, and we're not there. If we said, oh, well, these are countries where bad things didn't happen to children, that just isn't true. And they are countries that went through many difficult periods, many life stressors. But it's some preventive education, but it's also a contact point outside the family that can make people be pulled into a community where people are not suffering alone.
I think there's a really important thing that you're saying that I think even connects down to the individual level, right? So research suggests that children who experience an adverse life event they deal with that better when they have a single caring adult who can provide support for them. We are the caretakers of each other's, not just each other's mental health, but each other's physical health. That we actually, as a species, we've evolved to really be the caretakers of each other's nervous systems to some extent. And there's research to show that people live longer on average when they have healthy, reliable, supportive connections with other people, and they relatively speaking, live a shorter amount of time, all other things being equal. They live a shorter amount of time when they feel lonely or when they're isolated. So there's the provision of actual physical support, like, do you need food? Do you need, water? So the
Vaccines.
Vaccines, so the things that physically support people. But there's also a very tangible health consequence for being
Cared for.
and also for caring for other people.
Mm-hmm. What's your take on the biggest change in the context?
Well, earlier you said, have things gotten worse in the context in the last 30 years? And my answer would be, depends for whom you're talking about.
Mm-hmm.
So when we talk about the decline in U.S. life expectancy, the global story has been steady upward improvement in survival. COVID, 3 years of COVID, ended up being the first global reduction in life expectancy since World War II. We have every indication that that is going to snap back as we recover from the pandemic. The declines in life expectancy have been concentrated in white high school educated males. It has not occurred in the Black and Hispanic community. And unpacking that is actually super interesting. And credit to Ann Case and Angus Deaton at Princeton who did this work. A working class white person in the United States, they are highly likely by the age of 50 today to not be living as well as they did with their parents in their childhood. They're less likely to own a home than their parents, less likely to be stably employed. That combination also makes them less likely to have married, to have had kids, and if they have kids, to still have that relationship with their children. So, why didn't that happen to Black and Hispanic people? Civil rights allowed them to experience things that their parents didn't have. It appears that the reason why their overall life expectancy has continued to climb until the pandemic was that they were benefiting from a better context in their life.
So that goes to this amazing mind-body connection, which is, I feel like Vivek Murthy has done such great work with loneliness that has legitimized the study of those sorts of things as health factors. But one of the most curious mind-body connections is, I was in the room with my dad when he died. He didn't talk for 12 hours, he didn't move, he didn't open his eyes. Everybody left. I said, I'm going to be all right, you can go. Do you have a theory? Do you have data? Do you have research about that choice, that ability to, the will to live and then the readiness to die?
We don't. What we know about that last stage of the end of life, when people are in an environment where they're surrounded by family, it's a less medicalized experience where they get to prioritize what they want in addition to length of life, what quality of life is, and do I have control in my environment? We experience life as a story. It has a beginning, a middle, and an end. Being able to feel that I have brought this story to a close, I was able to say my goodbyes, I was able to address things that matter to me. Those are also experienced in really meaningful and important ways.
Yeah, it's just such an interesting example of two of those three categories, which is your environment and whatever nurture he felt on that day, and then agency, this somehow that he could close the door.